Review of minutes from July 7th, 2020.
Make a motion for approval.
I'll second.
I have a motion and a second. All in favor say aye.
Aye.
All opposed? Motion carries. All right, at this time, if anyone has any conflict of interest disclosure, this is the time that you would need to disclose that. And then also, this is the time if there's public comment on any agenda items, you would state your name and you will be able to speak on any agenda items. Okay, hearing nothing, I'm going to move on. So we're going to move into the quarterly investment report. Mr. Charlie Brown.
Hello there. Welcome. Well, welcome to you all. All right. I'll give you a little update as where I believe we are now. The stress from COVID is far from over. One of the issues is the emergence of the retail investor, and it displays kind of a sense of complacency on their part. About 25% of the activity in the stock market lately has been from individual investors, and we've had a lot of defaults, and there are going to be a lot more to come from far beyond most vulnerable corporations and sovereign borrowers. The defaults have been limited to hard-hit sectors, and that could change. Hard-hit sectors like hospitality, retail, and developing countries. Investors now seem to be showing somewhat of insufficient concern for what's going on and some of the issues that are facing the economy. I'm not sure whatever happened. This COVID stuff will probably be over in November, and I'm not sure what effect it will have whichever party wins. I suspect we're still going to see lower interest rates. If you remember, the interest rates were already low and trending lower at the end of the last administration, and so they're probably going to stay here. And we're looking at near 0% rate. You're getting a lot less than 1%, and I'll go over some of that when we get into our particular report. I'm sorry? Did you ask a question?
No, I think that was just some background noise. I apologize.
Okay, no, that's all right. The 500-pound gorilla in the room is the debt.
I'm sorry, hold on. Sorry. If you're called in, I'm going to ask that you need to mute your phone at this time.
I'm running my surgery.
Am I missing something?
No, Charlie, hold on a second. Is there a way we can mute him? We're working on muting everyone, Charlie. Hold on just a second.
No, it's okay. I just thought, I was afraid somebody was asking me a question and I couldn't understand it.
Oh, no.
Somebody has a phone.
Rude.
I want to make sure we have them muted before I have you start talking again.
Okay.
Microphone.
I'll give the secret of that mute button to my wife, though.
Good job. Now,
Actually, if you look for the person's name, you can actually select and review them.
I should be unmuted.
Yes, you are.
you can't hear us.
Okay, but you can hear me?
Yes, I think we're good.
Okay. So where was I? So the big thing looming now is the debt, and I think I've mentioned at several meetings that the ultimate test is going to be whenever we decide to do something about our debt, and it's gone up. Every $1 trillion that they do in a stimulus just adds to the debt. We're not, we have a deficit, So we're not creating anything, they're just borrowing money. And we're probably going to end up close to $25 trillion in debt, which doesn't hurt them right as much right now because interest rates are low. These low interest rates that we're receiving are being paid by the government, so it's not costing them much. But you have to remember a 1% rise in interest rates is an additional $250 billion a year in interest. That's a 1% rise. So it could have a big effect if you have a big rise in interest rates, which I don't think is going to happen for the foreseeable future. But if it does, that's going to make the debt more of a crisis. All right, I have the slides here. All right, if you go to the, after the cover sheet, the next one is the yield summary. And you can see that our average yield on all our investments has come down. It's less than 1% right now. Just 1 minute. I have to get my form out. I can read it better. It's less than 1%. However, you look at down at the bottom, the Treasury notes, and most of our investments are direct obligations of the government. But you look down there and you have to go out 10 years to get a little over 0.5%. So relative to the market where we are right now, considering everything that we've got is due in a year or less, and we've got almost a 1%, which, the 30-year Treasury note right now is at a 1.49. If you go to the next slide, you can see the change in interest rates over the last year. The top line is the interest rates in 2019, and the bottom one is the interest rates this year. And you can see it's more of a normal yield curve where you start out with lower returns in the short end, and they get higher as you go out, but you go out 30 years and you're still getting less than 1.5%. Go to the next slide. That just shows the asset distribution used to have a different piece of the pie. But since everything is now short term, which we consider anything that's due within a year or less, and that's where all the investments are right now. As I pointed out, if you go out 10 years, you only get a little more than 0.5%. Right now, we're better off playing in the short market, even though the last T-bills that we bought, our return was 0.10%. That's 10 basis points. So I don't see any reason to change basically what we're doing now. I'm assuming that you've got enough income coming in. You've got a bond to pay off on in September, about $1.8 million. And that's the only big expenses I see that might be coming out of here, unless Steve has something else in mind. So as far as I can tell, we've been keeping everything within 3 months. We may, as you get feeling more comfortable, go out maybe as much as a year and pick up another 10 basis points. That we're just dealing in pennies now, and we have to try to do everything we can to get as many pennies as possibly. That's really about all I've got, unless you've got any questions.
Any questions for Charlie tonight? Well, we're going to go ahead and approve Charlie's report, so I'll entertain a motion.
Make a motion for approval.
I'll second.
I have a motion and a second. Any further discussion? All in favor say aye.
Aye.
All opposed? Motion carries. Thank you so much, Charlie. I hope you have a good evening.
Well, and I thank you all very much, and please stay safe and stay healthy.
You too. Tell Teresa we said hi.
Okay, I will. She'll be glad to hear that. Bye-bye.
All right, we're going to move on to the quarterly investment officer certification, Mr. Ewing.
And I submit that with, I don't have it with me to read, but I submit it for the board's approval.
Okay.
It's just certifying that, as you saw, all of our investments are within line with the state statute.
Okay.
Make a motion for approval?
I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. And then we're going to move right into the finance report month ended June 30th.
Okay, so I'm going to take this off so I can speak and y'all can hear me for a moment. Volume-wise, we still continue to see volumes less than, wait a minute, we've got the wrong month up here. We should have June. This is April. Yeah, that's it.
Yeah, no bueno. I got June.
Yeah, there's,
I got June right here.
okay. There we go, that's better. Can we hit F5 to make it big? Or whatever it is to put on the screen?
Slideshow. Slideshow.
There we go. Okay, you gave me a little bit of a heart attack there, right? 800, I was expecting 1,000 for admissions. April was by far, as you can see here on the slide, 805 was our lowest month, so I didn't want to have to go through that nightmare again. We are still trending below prior year and budget for admissions, 1,114 admissions for the month. That's a 14% decline over prior year. On a year-to-date basis, we're a little under 10,000 admissions. This is 9 months ending for the fiscal year, so we're 7.4% behind last year. And then on an annualized basis, we're at 13,318 admissions for 12 months, which is roughly a 5.5% decline to prior year. Now, when we throw in the outpatient segment of our business, you can see our adjusted admissions were 1,982, down 10.8%. So we had a little bit stronger outpatient this month than we did inpatient. Year to date, 9 months, 18,862 and 25,805 on an annualized basis. Our average daily census for the month has come up. You can see April was very low at 126, really 127. We're back up to 158. We're not where we normally are, which is in the 180 range. Last year we were 188, but we're gaining as far as where we were previously. Year to date, we've got an average of 166 for the 9 months, and for the 12 months, 167. Deliveries, this is the one area that we continue to be strong month over month. 182 deliveries for the month. Prior year was 158. We're up 15.2%. Annualized, we're well above the 2,000 mark at 2,231 deliveries, which is a 16.4% increase over prior year. Surgery cases, this is a very pleasing number. We came in at 749 surgery cases for the month of June. Last year we were at 729, so we're ahead of last year's number slightly by 2.7%, but we're ahead, which is always a good thing to report. Year to date, we're at 6,249, which is a 16.5% decline. I will tell you, we did fall back in July a little bit. We came in right at 608. So Even though we had to shut down some of our elective surgeries with the second round of the governor's order, we didn't see the levels that we had in April or even in May. We came in fairly strong, so that's encouraging news also. Emergency room visits, this one continues to be off. 3,162 visits for the month. We're off 29% to prior year. Roughly 36,000 visits for the 9 months, off 12.7%, and we're right at the 50,000 mark on an annualized basis. But you can see the huge disparity in ER, even though we're still treating a lot of COVID at this point. Total outpatients occasion to service, as I said, this is stronger than our inpatient side. We're only off 5.5% for the month, 21,788 outpatient occasions. Year to date, 203, which is 7.8% off, and annualized 278,000. Urgent care, I'm not sure what happened last year. It really went down on the urgent care side, but we had a strong month this month. In fact, it was better than budget, 2,345. Year to date, we're at 19,994, annualized 25,000. So a nice recovery here on our urgent care visits. Total pro care, this is an interesting picture too. You can see we're very close to last year's number. We're only off 3.9%. A good chunk of this is the telemedicine that we're doing, but it's still a nice recovery on our pro care office visits. Annually, for the first 9 months, right at 80,000 visits and annualized 109,000 visits. So we're off 9%, taking this dip that we had on pro care side. Now, staffing wise, excuse me, 1,699 FTEs for the month. Thank you. Which is a 13.9% reduction to prior year. We're still managing our FTEs, those that have been flexed off and those that are being managed to our staffing standards. And I think this is, as far as FTEs, I want you to remember this number, 13.9% off, because when we get to the dollar cost, it doesn't align exactly with that. But you can see we're still trending quite below where we were last year and budget on our FTEs. When we look at it on a paid hours per adjusted patient day, we're down 7.1%. So we have declined not as much in a per hours per adjusted patient day, but we're still doing good versus budget and versus prior year. We're slightly ahead on the 9 months to budget and prior year, and we're at 28.6. I believe both of these numbers will continue to roll down to prior year numbers by the time we get to the end of September. Accounts receivable, we can see the real dip here in May. We only collected $14.6 million in total cash receipts. This followed closely. Remember, April was our real low month, with the majority of our payables being in Medicare. Those get paid rather quickly, so we saw that jump down. We've also seen a nice recovery back. We've been able to collect some older receivables due to some stuff that's being done here locally at the business office. We're still not where we need to be. We need to be in the $21 million range, just given where our gross receipts are at this point. But we have work that we're doing, talking with RevWorks, which is now called R1, with the merger that they just went through August 1st. We're hopeful that we'll get to see a little bit more improvement in some of our collections. Our total accounts receivables, you can see, have gone back up again with the increase in our business from the low in April. We're back up here to 249 million in gross receivables. Total revenue and deductions. Now, this is encouraging. To be down the volume levels that we were down, but our gross revenue only being down 4.6% is always encouraging. On a year-to-date basis, we're down 9%, but you can see nice increase here in our gross revenues. Now, our net patient revenues are pretty much flat for the month, which was surprising, and that's just due to some recoveries we've had within our bad debt area. Year to date, we're still off 7.1%. Annually, we're at $275 million in net patient receivables. I want to point this out. This is how much we've come down from prior year. Last year, on an annualized basis, we were at 295. We're down to 275. It's $20 million in true net patient receivables. 14 of that 20 has come from just the COVID time period, March to June, in lost revenues that we've had that we've not been able to recover. The rest was just volumes that we didn't have prior to COVID. So that is an area is of some concern. Not so much the 14 million that we've lost in net revenue, but the fact that we were down prior to COVID in net patient revenues. Other revenue, you see this line is quite tall. This month we received $18.5 million in CARES grant funding. If I'll remind the board, CARES grant is monies we do not have to pay back to the government. It's meant to cover our additional operating expenses and our lost revenues, which we have every bit of the 18.5 that we've been paid for. We were part of a special allocation in the month of June for safety net hospitals. Not all hospitals received it in the state of Texas. There were only 47 that did, and we did because of our high Medicaid population as a safety net hospital. Operating expenses, salary, wages, and labor, you can see we're 16% below here in total wage dollars, even though our FTEs were in the 13%. Now, part of that is just due to management, especially of our contract labor. Now, we're going to incur some more contract labor now because volumes are coming back, but down in these months right here, we eliminated all the contract labor that we possibly could. Probably 90% of all of our contract labor was eliminated. And so as a cost structure, that's always a higher piece. So we've been able to eliminate more than our total FTEs. Our benefit expense was down 8.9% to prior year. This month was the last month we finished our GASB 68 true-up. So if y'all recall, in our audit adjustment, we had an audit adjustment in September last year. We told you we wouldn't have that in this year with an audit adjustment. We made sure that we were true. We got that booked in the month of June, so we shouldn't have any kind of adjustment when we get the audit report next year. Flag expense continues to be down compared to prior year. That's just given our volume declines. Purchase services, we continue to work well on that. You can see we've had a nice decline in purchase services, and we continue to work very hard at negotiating further purchase services down. Total operating expenses are down 3.4 million towards last month. Nice decrease right here. Annually, we're at 273. Annualized operating expenses 370,000. So you can see we've had a decline here in our operating expenses along with our gross revenue, our net patient revenue, but still we'd like to see a little bit more in operating expenses, but we've been able to manage it. Whoops, too fast. Operating EBITDA, I am pleased to tell you that in this time, even without the COVID extra money we got, CARES grant, we actually turned an operating cash flow profit. of $800,000. So I'm happy. I'm not projecting that for July or August, but we did have a little bit of a pickup in some bad debt, and I think that helped us in that. But you can see that's a long way away from April when we lost $9.4 million to come in the month of June and have a positive cash flow for the month. It is a variance. We had a budget of 1.8. Year to date, though, we're still at $13.7 million negative operating cash flow. And you can see a good chunk of it came here in April. Another part came in January when we had to take the true up for the outage adjustment. Days cash on hand. This is another one that I say is somewhat of an anomaly. We were never planning to have over 105 days worth of cash, 108. But we're very stingy with getting some of our larger out-of-town national accounts paid. We've stretched those. We've started paying those down in July. But a good chunk of this, probably from here up, has come about due to the CARES grant funding and also the additional funding we've gotten front-loaded from the state for our disproportionate share contributions. Normally, we would get monies in August and October. The state, along with the federal government, wanted to ensure that we had the liquidity. They paid those in the May, June time period. And so consequently, we've got roughly 50 plus days here in cash of just additional governmental funding that was not truly anticipated when we started this back in April. So we're at a good point. The thing that and part of it's just presentation. If y'all all heard Charlie talking about the fact that we're only getting 10 basis points for our investments. One of the things we did, though, during this last quarter is we had some of those mature. Instead of keeping them in cash, we turned them back into short-term investments so they would show up as investments. It's more of a mental thing, but if you remember from the slide, it said we had $50 million worth of investments. Well, that's in here, and I'm not trying to, I'm trying to keep that segregated and keep it as a true balance sheet. It's an investment. It's not something we're touching. It's sort of a true bank account, savings account. It's out there. The other 60 days is what we'll now use during July, August, September, October. I mean, to get us really to the first of the year and hopefully past COVID, we'll see. But the intent at this point, just looking out when we do cash flow projections on a weekly basis, I'm feeling very comfortable as bless you. As I joke, we're well past Halloween. We're now to Thanksgiving and probably to Christmas time as far as when I might have to dip into the $50 million investment. So at this point, I think we've got a good cash here. We aren't looking to do anything as far as asking for the Medicare advance payment. We passed on that back in the April time period simply because if you borrowed in April, they want you to turn around and start paying it in August. And that doesn't do us any real good here. We also have a tentative line of credit being discussed with Frost, but we've not done anything with that. If we move further on that, we'll bring that to the finance board and then to the full board. But the point I'm trying to make here is we're sitting at a fairly good cash position right now. So, I don't want to do things that would put more cash that don't really help us. All right?
Steve, question.
Yes, sir.
You mentioned the state money.
Yes, sir.
Was that 100% or a partial payment?
It was 100%. When I say the state, they paid us
Okay.
in August. They paid us now what they would have normally paid us in August and October.
Okay.
Now we are getting, there's a little incremental with the CARES grant on the state level. We're getting an additional 6% on those funds too. So in addition to getting them front loaded, we got 6% more than we normally would.
Thanks.
Any other questions? Madam Chairman, that's all I have.
Can you go back to the revenue? I had a question.
Yes,
Can you
sir.
back it up about 6 slides?
We'll back
Go
up.
back up. Never mind. I'll ask you later. It's okay.
There we go. Net revenue probably,
Keep going.
Up.
keep going, right? No, keep going. Net revenue should be right
I
there.
think it's gonna be slide, the one that says total patient revenues.
Yeah, that's gross revenues.
Yeah, so this number right here, this number, that's that's $1.2 billion.
That's correct.
Okay,
Yes,
because that's in millions.
yes.
Okay, that's,
Yeah, it's 1.2 billion gross billings. That if you turn to the next slide,
turns into, yeah, I'm with you.
turns into 275 million.
Okay, good. Thank you.
Okay.
That's all.
All right, thank you, Mr. Ewing.
Mhm.
Have any questions or discussion for Mr. Ewing? If not, I will entertain a motion to approve the finance report.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed? Motion carries. We're going to move into the consent agenda.
Madam Chairman, all these A through I, these are all contracts that are renewals. And I don't know if we've had those in here before, but just out of complete transparency and just to make sure everybody sees what we're renewing, we have these on here for y'all to approve these renewals, and these have all been through the committees and are recommended for approval.
Okay, thank you for that information. I'll entertain a motion for the consent agenda.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye. All opposed? Motion carries. And then we'll move into capital expenditure request, Mr. Collins.
Mr. Chairman, what I have here is just seeking the board to ratify an emergency purchase that we had to make for a portable X-ray C-arm. The story is, we have 7 of these, and 4 of them are over 10 years old. We've done the best we can to keep them going, but they are all in various states of disrepair and failure. And one has just stopped functioning completely, so we had to purchase another one. Steve's frugality is wearing off on all of us. We were able to find a demo unit for about 1/3 the price of a new one. I'm asking for you to ratify this purchase of $101,000.
I like that it's rubbing off. That's good.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye. All opposed? Motion carries.
Thank you.
Thank you. All right, and then we'll move into the ratification of emergency purchase of the Bullard PAPR system. Mr. Ewing.
I see my name on this. Kristen, do you want to speak to what this is? I know I can speak to it, but you're having a CFO talk about something that's really nice. I approved it simply because of our emergency funds that we did get, and this is for emergency PPE, but if you want to describe to the
It is. The PAPR system is an overhead unit. Basically, most people in lay terms would be like an astronaut helmet, to where it's got its own mobile pack for breathing apparatus and those types of things. So that when they go into the COVID unit, these people are in these units 24/7. So when they use these all day, it allows them to have some flexibility and a little bit more safety in regards to the overall air that they are breathing in and out. It kind of filters. So we bought 100 of those units. 50 have already arrived. 50 of them were actually supposed to arrive today. We're training the staff so that very select groups are wearing those. If you're in the COVID unit, so nurses, techs, physicians, they've got that extra added layer of precaution in conjunction with their mask.
Thank you. I didn't know what it was on login. Thank you. All right, I'll entertain a motion.
Make a motion for approval.
I'll second.
I have a motion and a second. Any discussion? All in favor say aye.
Aye.
All opposed, motion carries.
Madam Chairman, just for our people online, I know it's not on the agenda, but if you want to declare that there's a quorum here or a call roll, just to make sure everybody knows we had enough in here to have this meeting with enough people. Just a suggestion, but I think that we'd like to have that entered into the minutes so we know that there was a quorum present.
Oh, absolutely. All right, so I'm just going to go ahead and do a roll call, and you can say that you're here. So Wallace Dunn,
Aye.
David Dunn,
Here.
Dr. Benton,
Here.
Dr. Davenport,
Here.
Mr. Ewing,
Here.
and Mr. Tippin,
I am here.
and I am here, Brent Todd.
Thank you.
All right, with that, we will stand adjourned.
Thank you.